This is our Module 14 oral presentation and teamwork. Our group chose the topic Fertility Today for Teenagers and Adults. Our members include Deidre Allen, Karen Quiller, Mary Williams, myself, and Warren Wilson. This is our background slide. The topic of this lab is fertility, infertility, and we're focusing on statistical information on today's teenagers and adults. We are including factual data charts and tables to show potential impact of the rates on U.S. human population growth. We're also showing trends with emphasis on demographics such as gender, race, ethnicity, age, and lifespan. This presentation is a collaboration of data research from each of our team members. The status of fertility today for teenagers and adults, known as the general fertility rate, GFR, for the United States in 2013 was 62.5 births per 1,000 women aged 15 to 44. This was down 1% from 2012 and is a record low rate for the nation. The GFR declined for two of the three largest race and Hispanic origin groups in 2013 from 2012, down 1% for non-Hispanic Black and 2% for Hispanic women. However, the rate rose less than 1% for non-Hispanic white women. Okay, according to some of our charts and tables that we've included, there is a breakdown by different age groups. We will show that birth rates declined for all women under age 30 in 2013 from 2012. The rate rose for women aged 30 to 39, 40 to 49, and it were unchanged from women aged 40 to 44. The teen birth rate for the United States in 2013 was down 10% from 2012. Now, the Centers for Disease Control, reasons not clear, they think that maybe teens are less sexually active and that more teens are using birth control than in previous years. The birth rate for age 40 to 45, which includes women aged 50 and over, was increased by 14%. There were 677 births to women aged 50 and over in 2013, and this was up from 600 in 2012. Our statistical reporting has been provided by various examples of charts, tables of data research in the databases of Center for Disease Control, Texas Department of Health, Child Trends Data Bank, and information from the National Biostatistics. Birth and fertility rates are presented by age, live birth order, race, and Hispanic origin.
The fertility rate is defined by the National Center for Health Statistics as the total number of live births per 1,000 women aged 15 to 44 years. These rates are based on the most recent population estimates from the Census Bureau. Birth rates are different from fertility rates in that the denominator is not all women aged 15 to 44, but rather a specific age group.
Okay.
Importance of fertility rate. The fertility rate measures the number of births occurring per 1,000 women between the age of 15 and 44 in a particular year. Birth rate refers to the measurement against a particular age group. Tracking trends in fertility and birth rate is essential in planning for the current and future needs of multiple generations. Sustained high fertility rates lead to disproportionately large populations of young dependents, driving demand for support for young families, for inadequate numbers of schools, and for affordable child care. 1 to 2, for example, during the baby-boom period, anticipated high fertility rates caught communities unprepared, and without the school facilities needed to accommodate rapidly increasing numbers of school-aged children. On the other hand, sustained low fertility rates can lead to an aging population and, in the long run, placed burdens on the economy and social services because the pool of younger residents responsible for supporting the elderly accounts for a relatively smaller share of the population. Tracking age-specific race and specific trends in fertility and birth rates also provides information on the divergent needs of different population groups. Tell your doctor if you have liver disease or are taking other medications. Fertility rates in the United States declined sharply between the baby boom years of the 1950s and early 1960s and 1976. Since the 1970s, fertility rates have been relatively stable, varying between 64 and 71 births per 1,000 women. There were small peaks in 1990 and 2007, but rates have since gone down and are the lowest in recent history, standing at 63 per 1,000 women in 2013. The total numbers of births in 2007 was 4,317,119, was the highest ever registered in the United States, though that annual number has since fallen. And with fever, aches, and chills, mom knows it needs a big solution.
Oh.
And this graph will show the different ages of women and teens that have given birth per 1,000 women in 2013. As shown in this slide, ages 25 to 29 was the highest age that gave birth in 2013. And this graphic shows the fertility rate per 1,000 women ages 15 through 44 by race in 2013. On the graph, we show the non-Hispanic white was at 58.7, the non-Hispanic black was at 64.6, the Hispanic rate was at 72.9, the Asian or Pacific Islander was at 59.2, and an American Indian or Alaska Native was at 46.4.
Okay, now I'm going to.
For Texas, regions 1 through 11, Hispanic had most percentages up to 7%, Black had up to little over 5%, White had up to 3%. To name a few counties, Austin had 12% for Black, Baylor had 8% for White, B had 6% for Hispanic. All others were below. For births to mothers ages 17 and younger, Texas had over 12,000 total. Hispanic had over 8,000. All others were below. Texas had highest in total pregnancies, live births, fetal deaths, abortions in female ages 15 through 44. Region 9 had highest pregnancy rate. All others were below.
Variation in teen birth rate across population. Teen birth rate differs substantially by age, racial, ethnicity group, and regions of the country. Most adolescents who give birth are 18 or older in 2013. 73% of all teen births occurred to 18 to 19-year-olds. Birth rates are also higher among Hispanics and Blacks adolescents than among their white counterparts. In 2013, Hispanic adolescent females ages 15 to 19 had the highest birth rate, 41.7 births per 1,000 adolescent females, followed by Black adolescent females, 39.0 births per 1,000 adolescent females, and white adolescent females 18.6 births per 1,000 adolescent females. Estimated from 2013 data show that 11% of the adolescent females in the United States will give birth by her 20th birthday, with substantial difference by race ethnicity. 8% of white adolescent females, 16% of Black adolescent females, and 17% of Hispanic adolescent females. Although Hispanic currently have the highest teen birth rates, they have also had a dramatic recent decline in rates. Since 2007, the teen birth rate has declined by 45% for Hispanics, compared to declines of 37% for blacks and 32% for whites. See the figure 1 for the birth rates per thousand females ages 15 to 19 by race and ethnicity between 1990 and 2013. Table 1. Birth rates per thousand female ages 15 to 19 by race, ethnicity between 1990 and 2013. As you can see, the number has dramatically decreased from 1990 to 2013 in all ethnicities. Numerous individual, family, and community characteristics have been linked to adolescent childbearing. For example, adolescents who are enrolled in school and engage in learning, including participating in after-school activities, have positive attitude toward school and performing well educationally, or less likely than others adolescents to have or to father a baby. At the family level, adolescents with mothers who gave birth as teens and or whose mothers have only a high school degree are more likely to have a baby before age 20 than are teens whose mothers were older at their birth or who attended at least some college. In addition, having lived with both biological parents at age 14 is associated with a low risk of a teen birth. At the community level, adolescents who live in wealthier neighborhoods with strong level of employment are less likely to have or to father a baby than other adolescents in neighborhoods in which income and employment opportunities are more limited.